What inspired me to be a nurse was actually my mum, because my mum is a nurse and I'd like to think I got the caring gene from her. What I love most about my job is being able to be there for my patients when they really need me most, even if that means just listening to their worries or holding their hand. And what I find most challenging about my job is understanding that you can't heal everyone. As a nurse, that's what we all want to do, and it's been challenging when we know that we can't do that.
What I love about my job is meeting interesting people from all different cultures. What's challenging about my job is difficult patients and families, but we get through it. I've been nursing for 44 years because my friend inspired me to become a nurse because she enjoyed it and I've enjoyed it too.
What I love about my job is being able to help patients understand what's happening with their health and breaking down medical information. And also what inspired me to be an Aboriginal health practitioner was to help people live better and longer lives. Some of the challenges are really trying to get in contact with patients once they head home, to just, get updates and to see how they've been travelling since they've left us.
What I really love about my job is that being part of this nursing workforce that really contribute together and work really hard together, that the patient journey is influenced by the workforce being engaged and feeling like they're valued. And I think in SALHN, the staff do feel valued. And that's why I really love my job and working in this field.
I love my job here in the NICU because I know I make a difference to the babies and the families, helping them to transition from NICU through to going home. Some of our babies are here for 3 or 4 months. This year is the International Year of Nurse and Midwife, which I'm particularly excited about because I get to celebrate both. And we are faced with exceptional challenges this year with COVID-19, but I think everyone is pulling together and working as a team and doing really well.
I'm really proud to be a nurse. I enjoy looking after and caring for other people. The unit that I work on is really supportive. Everyone goes above and beyond to help other people every day. International Nurses Day is really important to me. All over the world at the moment, nurses are doing their best to care for others and their families in a really difficult, challenging time. I'm really grateful for this day to recognise the dedication that all the nurses do every day to look after people.
What I love about my job is caring for older people. It's a privilege to be able to give a little back to a generation that have given us so much. I also love working with a fabulous team. The challenges I face in my job are every day, and every day should be a challenge. We should be always looking at what we can do differently, how we can meet people's needs differently, and I think COVID-19 is a perfect example of why we need to be working differently sometimes.
What I love about my job is meeting people from all walks of life on a daily basis and being able to support them through end-of-life care, which I feel is a real privilege. What inspired me is that my mum worked in a hospice, so from the age of 12 I used to go to the hospice and it became natural for me. I wasn't fazed by it.
I love being a midwife because I think that we're very privileged to be able to share what's sometimes scary but very exciting part of a woman's birth process with their partner. I initially wanted to become a midwife because I love babies, but I've now found that it's more about supporting the woman and empowering them to bring their baby into this world.
Knowing I have made a difference toward improving quality of life and better patient outcomes gives me a great sense of satisfaction. Nursing has allowed me the opportunity to encourage and create positive change. The challenge for me is to bring together resources and supports to help patients safely manage what is often a very difficult and complex undertaking to remain at home.